The bones of the trunk include the vertebral column and individual vertebra, the ribs, sternum, and clavicle. Ligaments of the trunk include those that run lengthwise along the vertebral column, and those of the sternum that connect the sternum to the clavicles to one another, and the sternum to the ribs. Now, to give you a bit of context before we look at each of those bones individually, and this is a view of those structures, how they appear in the body. So similar to the previous module, we are looking at bones of the axial skeleton, or those that run along an imaginary vertical line going through the center of the body. So our vertebral column is this structure here and here. And our vertebral column is made up of many individual vertebrae stacked one on top of another. Our ribs form our rib cage, which surrounds our heart and our lungs. On the posterior side, our ribs articulate with or attach to the vertebra. On the anterior side, our ribs attach to the sternum. Our sternum is this bone here, which I appreciate is a little bit difficult to see on this image. But then either side of the sternum, just above our ribs, are two clavicles, which are also known as our collarbones. So our collarbones are our clavicles, and these bones here and here. So our vertebral column, which is also referred to as the spine, the backbone, or the spinal column, runs down the midline of the body and is composed of a series of bones called vertebrae. In addition to enclosing and protecting the spinal cord, it supports the head and serves as a point of attachment for the ribs, pelvis, and the muscles of the back and upper limbs. The total number of vertebrae during childhood is 33, but then as a child grows, several vertebrae in the sacral and the coccygeal regions fuse, and as a result, the adult vertebral column typically only contains 26 vertebrae. Now, our vertebrae are grouped into regions based on their location and their structural characteristics. We have 7 cervical vertebrae, which are found in the neck region, 12 thoracic vertebrae, which are found posterior to the ribs, 5 lumbar vertebrae, which support our lower back, 1 sacrum consisting of 5 fused sacral vertebrae, and 1 coccyx consisting of 4 fused coccygeal vertebrae, although there is variation between individuals. Now, when viewed from the anterior or posterior, so the front or the back, a normal adult vertebral column will appear straight. So you can see that on this side here. Our vertebral column looks quite straight. But when viewed from the side, you can see that it has 4 slight bends, which are called normal curves. Relative to the front of the body, our cervical and our lumbar curves, so this part here and also here, are convex, which means they bulge out or towards the front. Our thoracic and our sacral curves, so this portion here and then here, are concave, which means they dip in. The curves of the vertebral column increase its strength, help maintain balance in an upright position. It absorbs shock during things like walking, and it also helps protect features or landmarks on our vertebra from fracture. Now, for this unit, you're required to identify structures formed by the vertebral column as a whole, the individual vertebrae that make up the vertebral column, as well as landmarks or features on the individual vertebrae. So starting with landmarks or common features on our individual vertebrae, and first we have the vertebral body, also called the body of the vertebra, which is this thick disc-shaped portion at the front of the vertebra. So on this image, it's this part here. On a side-on view, you can see it here, here, and here. This hole in the middle of the vertebra is called the vertebral foramen. So remember, foramen means hole, vertebral referring to the vertebra. And when all of the vertebrae are lined up on top of one another, this is where the spinal cord runs through. So this yellow structure here is our spinal cord. When all of our vertebrae are lined up on top of each other, we also have another set of holes. These are called our intervertebral foramina. So inter referring to in between, vertebral, the vertebra, and then foramina referring to multiple holes. So these are the holes that are formed when two adjacent vertebrae connect and through which the spinal nerves will enter and exit the vertebral column. So you can see one example here. This intervertebral foramina is formed by the junction of these two vertebrae. Our vertebrae then contain a number of processes. So two transverse processes that extend laterally on either side of the vertebra. So we have one here, here. You can also see them on this image here and along here. We have a single spinous process which projects posteriorly, so towards the back, that sits in between our two transverse processes. All three of these processes serve as points of attachment for muscles. The vertebrae then contain a further 4 processes which form joints with the vertebra either above or below. So we have 2 superior articulating processes or superior articular processes. These project to the top of the vertebra. And then we have 2 inferior articulating processes or 2 inferior articular processes that project inferiorly, a bit hard to see on this one, inferiorly from the vertebra. Now, the superior articulating processes of one vertebra will articulate with the inferior articulating processes of another vertebra, and so on. Now, aside from the common vertebral landmarks, for this unit, you will also be expected to be able to identify each different type of vertebra. And while that can seem a little bit overwhelming initially, there are some really obvious characteristics of each type of vertebra that will allow you to do this. So starting at the top of the vertebral column with our cervical vertebra, and the bodies of the cervical vertebra, which are our first 7 vertebrae, are smaller than all of our other vertebrae, except for those little ones down the bottom that form the coccyx. A unique feature of the cervical vertebra is that they contain 3 foramina. So our vertebral foramen, which remember is where the spinal cord runs through, and then 2 transverse foramina found in our transverse processes. So we have one here and one here. You can also see that here, here, and here. Now, the first 2 cervical vertebrae are a little bit different to the rest. The first vertebra, or C1, is known as the atlas. So this is our atlas up here. The second vertebra, or C2, is known as the axis, and that's shown in both of these images down the bottom. So the unique feature of the atlas, or the first vertebra, is that it lacks a body and a spinous process. So you can see there's no body of the vertebra here and no spinous process. But it does have these 2 surfaces on the superior side called superior articular facets. And these articulate with the occipital condyles on the occipital bone of the skull and allow your head to actually nod yes. Our axis, or our second vertebra, contains a vertebral body, but this forms a bit of a peg-like process called the dens. So you can see that here and here. And the dens projects superiorly through the anterior portion of the vertebral foramen on the first vertebra, and it serves as a pivot point on which the atlas and the head can rotate to allow your head to shake no. So this dens comes up here through the atlas. Your head will then sit on top of that, And that's how you can shake your head no. Moving on to our thoracic vertebra, which sit underneath our cervical vertebra. And there are 12 thoracic vertebrae, which are all more uniform than our cervical vertebra. So they're all more similar. The thoracic vertebrae are considerably larger and stronger than our cervical vertebra. And one of the unique features is that the spinous process of our thoracic vertebra, particularly from T1 to T10, or those first 10 thoracic vertebrae, are quite slender and they point downward, compared to the other vertebra, where most of the time they're in line with the vertebral body. So you can see this this spinous process here is a little bit pointy on the end, and it projects downward, whereas most of our other vertebra, it projects in line with that vertebral body, straight out to the back. Our thoracic vertebra, either whether you look at it from the back or the side, also looks a little bit like a giraffe. So make sure you have a look at those in the lab. The thoracic vertebrae are also easily identified by the presence of a costal facet. So this is where the tubercle of the rib, which we'll look at shortly, will articulate with the vertebra. So we clearly only have our costal facets where we have our ribs, and our ribs articulate with our thoracic vertebra. Continuing to move inferiorly down our vertebral column, and next we have our 5 lumbar vertebrae. And these are the largest and strongest of the unfused bones in our vertebral column. The body of the vertebra are large and oval shaped, and the transverse and spinous processes of our lumbar vertebra are short and thick. The spinous process in particular is quite rectangle in shape, particularly compared to the pointed spinous process of the thoracic vertebra, which sit just above. So they're big vertebra. They contain big oval bodies, which you can see superiorly and on a lateral view. And our spinous processes are quite rectangle compared to the pointed spinous processes of our thoracic vertebra. The final regions of the vertebral column, so our sacrum and our coccyx, are quite distinctive. So you shouldn't have too many issues trying to identify these structures. The sacrum is a triangular bone, which is formed by the fusion of 5 sacral vertebrae. So it's this structure here. And it sits medially to our 2 pelvic bones. So if you imagine this sits in the middle of our vertebral column, right at the bottom, and then we have one pelvis and then the other pelvis sit there. On the posterior surface of the sacrum is a raised median crest. So that's this lump or ridge running down here. And that's formed by the fusion of the spinous processes of these vertebrae. Within the sacrum is a sacral canal. So you can see that running down the middle there. And this is a continuation of the vertebral foramen or the vertebral cavity. On the other side of the sacrum, on either side, are roughened ear-shaped surfaces called auricular surfaces. So you can see one here, here, or on the other view, here and here. And these surfaces articulate with the auricular surfaces of the pelvis. So you have auricular surfaces both on the sacrum and on the pelvis, and it's where these bones will meet. The coccyx is then this smaller bone at the very, very bottom of our vertebral column, usually formed by the fusion of 4 coccygeal vertebrae, although this number can vary between individuals. Now, the individual vertebrae which make up the vertebral column are connected to one another by a fibrocartilage disc called an intervertebral disc, and they sit between the bodies of the adjacent vertebra. So our intervertebral discs are these structures here and here. The intervertebral discs permit a degree of movement between adjacent vertebrae, as well as act to absorb shock and the compressive force of gravity. Supporting the intervertebral discs and running lengthwise along the vertebral column are 3 ligaments. Remembering ligaments connect bone to bone and are named due to the bones or the landmarks which they connect and or their location. So if this is a sagittal or side-on view of the vertebral column, this is our body of the vertebrae here, so the front. These are our spinous processes, so this is the back here. And then this red ligament running along the front or the anterior side of those bodies of the vertebra is our anterior longitudinal ligament. This purple ligament, which runs along the back of the body of the vertebra and actually sits within the vertebral foramen, so kind of in where the spinal cord sits, is our posterior longitudinal ligament. And then this yellow structure here, which sits at the very back of the vertebral column, connecting all of our spinous processes, is our supraspinous ligament. So supra, because it sits superiorly or on top of our spinous processes. Now together, these 3 ligaments keep the vertebral column in an alignment and allow for movement of these vertebrae, but without actually displacement of any of those individual structures. Forming the bones of the thoracic cavity or the chest are then the sternum and the ribs, and then to a lesser degree, the clavicle. And the sternum, which we have here, which can also be called the breastbone, is a flat, narrow bone located in the center of the anterior thoracic wall. So on this image, you can see it right at the front of our rib cage there. The sternum is composed of 3 parts: the manubrium, which forms the roughly triangle superior portion, the middle and largest portion, which is called the body, and then the inferior and pointy portion called the xiphoid process. Now, these 3 portions all begin as individual bones, but by age 25 are typically fused and then known as one bone called the sternum. On the superior surface of the manubrium are 3 small indents or depressions. So you can see 1, 2, 3. The middle depression is called the suprasternal notch, as it sits superiorly to the sternum. The 2 indents on either side are called our clavicular notches because they articulate with the medial end of the clavicle and form our sternoclavicular joint. 12 pairs of ribs, numbered 1 to 12 from superior to inferior, make up the lateral walls of our thoracic cavity or our chest. And the ribs increase in length from the first down to the 7th rib, and then decrease in length from our 7th rib to our 12th rib. Each rib articulates posteriorly with our thoracic vertebra. And ribs 1 to 7 connect directly to the sternum anteriorly via a strip of hyaline cartilage called costal cartilage. And the ribs that have costal cartilages that attach directly to the sternum are called our true ribs. So if we look at these top 7 ribs up here, they go from the vertebral column at the back, they curve around the thoracic cavity, attach to this costal cartilage, and then directly onto our sternum. These are our true ribs. Ribs 8 to 10 are termed false ribs because their costal cartilages attach to one another and then to the cartilage of the 7th pair of ribs. So the costal cartilages here don't connect directly to the sternum. They connect to one another into that costal cartilage of the 7th rib and then into the sternum. So these are our false ribs. Our 11th and 12th rib are termed floating ribs because the costal cartilages at the ends, or their anterior ends, do not attach to the sternum at all, so they're floating. These ribs only attach posteriorly to the thoracic vertebra. Now, on a typical rib, the head of the rib is the projection at the posterior end of the rib that contains the articular facets and articulates with the facets on the body of a thoracic vertebra. So our head of the rib is this portion here, and then this portion here. The tubercle of a rib is this little process that sticks out here and here, so just down from our head of the rib. And this is the part of the rib that articulates with the transverse process of a vertebra. The final bone in this module is the clavicle. And the clavicle is a slender S-shaped bone, also known as the collarbone. It lies horizontally across the anterior side of the thoracic cavity, superior to the first rib. So you can see our clavicle running along here and along here. The medial end of our clavicle is called the sternal end. So it's more rounded and it articulates with the manubrium of the sternum to form our sternoclavicular joint. The broad, flat lateral end is called the acromial end, and it articulates with the acromion of the scapula to form our acromioclavicular joint, which we'll speak about when we come to the upper arm. The final landmark that you'll need to be able to identify on the clavicle is the subclavian groove. So the subclavian groove is a broad, rough surface on the medial and inferior part of the clavicle. The location of the subclavian groove can be used to help identify whether the clavicle originates from the left or the right side of the body. And it's also a site of attachment for the subclavius muscle. So our subclavian groove is just a little roughened portion of bone which sits in the middle on our inferior side. Now, stabilizing the joints between the clavicles, the ribs, and the sternum are our sternal ligaments. On the anterior surface, we have the anterior sternoclavicular ligament. So this ligament connects the sternum to the clavicle, and it's on the anterior side. Posterior to the anterior sternoclavicular ligament, which you're unable to see on this image, is our posterior sternoclavicular ligament. So these two ligaments actually sandwich the articulation between our sternum and our clavicle. They sit directly behind one another. In between our two clavicles, so this ligament in yellow here, is our interclavicular ligament. So this ligament attaches from the sternal end of one clavicle to the other, as well as the upper border of the manubrium. And then our green ligament is the costoclavicular ligament, and it connects the costal cartilage of the first rib to the clavicle above it. This is the major stabilizing structure of our sternoclavicular joint.